Thank you very much, everyone. I'd encourage you to all introduce yourselves in using the chat function if you want to get to know everyone else that's here. But I will get started. So, welcome everyone to today's event. My name is Mahmoud Nawaz. I'm the chair of Chesterfield Royal Hospital Foundation Trust. So just to get us going, NHS Providers, for those that aren't aware, I'm sure you all are, is the membership organisation for trusts and foundation trusts, helping them to deliver high quality, patient-focused care, enabling them to learn from each other, acting as the public voice and helping shape the system in which we all operate. If we could flip the slide, please. The support offer from NHS Providers focuses on three key areas: creating hearts and mind change, so fostering more safe spaces and authentic forums for discussion and to challenge mindsets and shared learning, which I hope you'll get a lot of today; increasing the confidence and capability to act by bringing attention to good practice case studies including the evidence of high impact interventions from within the NHS, as well as evidence of what has worked well in other sectors. And then finally, taking accountability, supporting governors and boards to take and to ask key assurance questions on race equality and to help embed race equality as a core part of board business, reducing the double burden on many of us as ethnic minorities on boards of both championing race equality whilst also experiencing discrimination, strengthening accountability and proactively calling out discrimination at a national level. I'm really delighted to introduce our four speakers today, Sandra, Gugu, Riaz and Khalida, who will all speak in just a second, all from NHS England. And I think we'll have a really, really good session today, which I hope will be very action orientated. And so I'm particularly looking forward to it. These peer learning events came out of scoping work where members fed back that they wanted to learn from experts and peers on a granular level of detail, which we will hopefully go into today. We do have a structure for the event today and some prompt questions, but as always, these sessions are best when led by you and the conversations that you're having. So I'll do my best as chair to allow that flow to happen as we can see it. On to the next slide, please. The full list of housekeeping is on this slide, but just a few key points. We will record the presentation and the Q&A for the plenary session. However, the breakouts and the feedback session will not be recorded. That's because we want to really employ Chatham House rules and encourage a very open conversation with everyone. But of course, with Chatham House rules, participants are free to use the information received, but the identity or the affiliation of any speakers or participants cannot be revealed unless specified, thereby creating a safe space. I'd encourage everyone, please, to keep your cameras on wherever possible. If you lose connection to the session, please rejoin using the link in your joining instructions or email race.equality@nhsproviders.org. Please remain muted during these presentations, and we will come to questions once we have heard from all our speakers. So if that is okay for everyone, I'm delighted to kick us off with our first plenary session. And hand over to Sandra to take up the reins. And as I say, we will do a Q&A once we have heard from all our speakers. But in the meantime, please do raise any questions in the chat so we can pick this up later as we go along. Sandra, over to you.
Thank you very much, Mahmoud. Really nice to meet you. My name is Sandra Eisman. Apologies for sounding a bit nasal. I am getting over a cold, so I'm just at the end of it, coming out of it. I'm head of EDI Policy Implementation Unit at NHS England. You might have come across the team before, possibly when it was at Health Education England, now within NHS England. And I'm delighted to also be joined by colleagues from our neighbouring teams today. Next slide, please. So we'll be talking to you today. I'm going to start by very briefly just remind you of the EDI improvement plan and the high impact actions, but we really want to talk to you today about the data that underpins the EDI improvement plan and some of the other data that's available for you to look at workforce inequalities in your organisation or in your system. So we'll look at the data, and then at the end we'll also signpost you a bit to the repository and any other support that you can get from us. Next slide. So I'm joined today by the lovely Gugu, by my colleague Rias, and by Khalida. So as you might know, in the new NHS England, the EDI team has now 3 separate teams. EDI teams you might have encountered us. So it's EDI policy, where Gugu, Khalida and I are working, and Rias is joining us from the mandated standards team. The third EDI team is education and training. Oh, Charmaine, I'm hoping you can see me now. I'm just seeing your notes. But Ruth is saying she can see me okay, so I'm just going to carry on if that's okay. And can I have the next slide, please? A brief reminder of the NHS People Plan. The NHS must welcome all with a culture of belonging and trust, and we must understand, encourage and celebrate diversity in all its forms. Can I have the next slide? So on the next slide, you'll see a bit more about why EDI in the workplace is important. But for me, and I've been reflecting on this morning, it goes back to the NHS People Plan, the NHS People Promise. And I think we really need to make sure that when staff come to work in the NHS, they belong. I do believe everybody has a right to come to work and feel like they belong. They feel that they're supported and heard, and feel that they can do the job to the best of their ability. And I think the benefits are clear for you. It improves, so it is the right thing to do, and it improves staff satisfaction, retention. There's a number of evidence, and it'll inspire other people to join the NHS. So on the next slide, I'm just quickly going to remind you of the NHS EDI Improvement Plan published a year ago. I'm assuming you'll be familiar with this. Next slide. And in the EDI Improvement Plan, we have 6 high impact actions. Number 1, I'm going to start in the top left corner. Number 1 is around chief executive chairs and boards having EDI objectives. Number 2 is around inclusive recruitment processes. Number 3 is around eliminating pay gaps. Number 4 is health inequalities within the workforce. Number 5 is support for internationally recruited staff. And number 6 on the bottom right is around eliminating bullying, discrimination and harassment. So these are the 6 actions that we are asking NHS providers and NHS organisations to look at and to demonstrate what they're doing. So what are we talking about specifically? So let's look at the first one in a bit more detail. Next slide. Thank you very much. So this is around that chief executives, chairs and board members must have specific and measurable EDI objectives to which they will be individually and collectively accountable. So I would love to hear later on in the breakout sessions from you, are you actually doing it? And what are some of your EDI objectives? What do they look like? But it's this high impact action is more than just the objectives. And if I can draw your attention to the bullet points on the bottom left, specifically the second and the third bullet point, it says that board members should demonstrate how organizational data is a lift and experience have been used to improve culture. So what are you doing to look at your data and your lived experience? And what are you doing as a result? And specifically, in the third bullet point, it talks about that NHS boards must review data to identify your areas of concern around EDI in your organisation and build an action plan around this and track and monitor the action plan. Next slide. The third high impact action, which I just want to highlight to you, it's around developing and implementing an improvement plan to eliminate pay gaps. And again, if I can draw your attention to the bullet points, the one in the middle, it's around, are you analysing data to understand your pay gaps by protected characteristics, and what are you doing about it? And specifically, the EDI Improvement Plan says this will be tracked and monitored by NHS boards. Again, would just love to hear in the breakout rooms later on what your experience is and what are you doing around it. and what else we can do to support you. The final high impact action on the next slide, which I just want to highlight to you, is around eliminating bullying, discrimination, harassment, and physical violence. The slide is quite busy. We'll send them around afterwards, but also just to say this is a direct lift from the EDI improvement plan. So online you'll find it, and it's exactly the same format. So I won't talk you through all of the slides, but just to highlight again the first bullet point. Again, it talks about reviewing data. So are you looking at your data? Are you identifying errors and concerns? What are you doing about it? And specifically for boards, if I may go to the third bullet point from the bottom, the plan is asking you to create an environment where staff feel free to speak up and raise concerns. And again, are you reviewing this by protected characteristics, and are you taking steps to ensure parity for staff? So this is just a brief introduction, and I'll hand over to, I believe there's one more slide for me. This is just for information. We'll send it out later, but let me hand you over to Gugu to tell you a bit more about the EDI dashboard.
Hello, it's so lovely to be here today to talk about some of my favorite subjects, data. To build on the context that Sandra has shared, I want to talk a little more specifically about the EDI dashboard. And sorry, can I have the next slide? Thank you. To build on the context that Sandra has shared, I want to talk a little more specifically about the EDI dashboard, and in particular, the high impact actions and the success metrics that can be found on the dashboard. The EDI dashboard is hosted on the Model Health System. Some of you may have already used it, and it may be new to some. And it is a suite of 12 aggregated metrics and indicators that are aligned to the high impact actions in the EDI improvement plan. The dashboard can be used to track the impact of organizations' specific actions in relation to EDI. The dashboard aggregates and triangulates several workforce data sets, some of which include National Staff Survey, the RES, the WDES, RES being the Workforce Race Equality Standard, the WDES being the Workforce Disability Equality Standard, the Gender Pay Gap, and the NETS, which is the National Education Training Survey. As mentioned, some of you may have already used some of these data sets, and these are the data sets that we use to inform the dashboard. Organizations will be able to see how they are performing in relation to their peers through data and insights that highlight staff experience and organizational culture. Can I have the next slide, please? Thank you. Accurate and relevant data is essential to measure the implementation and success of our high impact actions. The dashboard highlights each high impact action mapped against its specific success metrics, and it shows where each of the data sources come from. As mentioned, we're still working on the development of the success metrics for high impact action 1 and 3, but you will see from the table that, for example, we use the WDES and RES data collections, which look at representation in all posts and senior leadership for staff in these protected characteristics. And this is for high impact action 2 and 6. We also use the NETS to look at the quality of training of all staff, including our internationally recruited staff, as well as bullying and harassment for in training. For this particular success metrics, we are mapping this to high impact action 2, 4, 5, and 6. And we also use the National Staff Survey to look at areas such as access to career progression, training, and development, staff well-being and belonging for internationally recruited staff, which we all know is very important, reduction in bullying, harassment, and discrimination for staff. And this is primarily aligned to high impact action 2, 4, 5, and 6. May I please have the next slide? This is an example of what you will see when you go onto the Model Health System. This is an example of the EDI dashboard. On the top right corner, you can see your organization. You'll be able to see whatever the name of your trust or your organization is, or your ICB on there. And then just below that, it shows that this is the view for your specific organization. You will also see at the top that you also have like access to other areas like the library tools. You can also browse and look at the rest of the model health system. You'll also be able to select whether you want to see via, as you can see on the top left corner, whether you want to see it by your system, your ICB. You might be able to look at as well and see against your region as well. This also shows you what data you're looking at, the data period, whether it's the latest data or not. And then also on the left-hand side, on the top halfway, it says national high impact actions. Here you can select each high impact action to understand the data in more detail. You can see on there, we've got the high impact action 2, which is the overhaul recruitment processes and embed talent management processes. We've also got comprehensive induction and onboarding program for international staff. And then we've also got eliminating conditions where bullying and harassment exist. And then in the bottom left corner, here you can explore your results for each data source in more detail. You can see in that corner, we've got highlighted race equality, and you can look at whether you want to look at the RES, which is the Workforce Race Equality Standard, or you want to look at the National Staff Survey, BAME staff results. You can also look at the WIDES there as well. Could I have the next slide, please? Sorry. I'm going to now speak about the NHS People Pulse Survey. The NHS People Pulse Survey is a national survey that was developed to support listening and engagement events across the NHS, and it provides a national system and local view of experiences of staff and patients. The benefits of using the National Pulse Survey, for those that have not yet signed up to it, please sign up, because you will get like a personalized local view. You will be able to do some benchmarking on there. It is anonymous, it is quick to complete, and the results turnaround is pretty quick as well, which allows you to be able to pick out the issues and the themes that have been raised and also act on them promptly. I think that is the end of my presentation. If you'd like to move on to the next slide. I'll hand over to Riaz now.
Thank you, Google, and morning, everyone. My name is Riaz Patel, and my job title is the EDI Mandate Principal Lead. I think I'm still getting used to that. So I was part of the old Workforce Race Equality Standards team, and we've come together as the new mandated standards team. So my team look after both the RES and the WIDES collections. So before I go through my presentation, just to give a bit of an update in terms of the latest data collection. So the latest data collection happened over May time. The organisation level reports are nearly ready. We've just done some testing with some of the colleagues that are on the call today, and hopefully that they should be released in the next couple of weeks. The national report will come out probably around next year time. So I'm going to focus upon the organisation level report for my bit of the presentation. So hopefully you should have seen the organisation level report, because now we've come together as the mandated standards team. The RES report that you've seen previously will replicate exactly the same for the WIDES section as well. So just to go through this quickly, so if you've seen the report is very detailed. There's a lot of information in there, but I just wanted to pick out some of the key areas from the report. So the first page that you see there is the summary from the latest data collection. So we have all the indicators going down. So the RES indicators from 1 to 9. Then you see your trust level figures, your regional level figures, your trust type figures, and then your national figures. And then the last column shows you the rank. So the higher the number, the worse your trust is performing in that particular indicator. And this allows you to benchmark at a regional level, at a trust type level, and at a national level as well. So just highlighting some of the areas that we see under here. So the gap between 8C to VSM, which I'll pick up later in the presentation. That's highlighted red. BME representation, again, that's highlighted red as well. And then the likelihood of entering the formal disciplinary process is quite high for this particular made-up trust. So if we go to the next slide, please. So this is probably the best or the most important area in terms of the report. So the areas of improvement. So there's a lot of statistical testing that goes in the background. We look at how your trust is performing at a regional level and then at a national level. And these are the three areas for this particular trust that they need to focus their attentions upon. So indicator 9, so that's board representation. Indicator 3, the likelihood of entering the formal disciplinary process. And then for the clinical area, the gap between the percentage BME at 8C to VSM level, and that's compared to the workforce overall. And the areas of best performance for this particular trust, indicator 2, so the likelihood of being appointed from shortlisting, that's quite good for this particular trust. What we've done within the report is we've further broken it down. So this looks at all the detailed information. So I picked up for indicator 1, where we look at the clinical staff on the AFC pay bands. So we've got some narrative in here. So for the clinical areas, we've further broken it down to look at the more junior roles. So the support workers, the healthcare assistant roles, so band 4 and under. And then we look at the more senior roles, so band 5 and over. So there's a couple of charts in there. The first chart shows you the BME representation across the various different pay bands, and then further down it gives you the actual numbers. So again, just eyeballing some of the figures that we have here, we can see, just glancing through the figures, we have no BME representation at 8D, at band 9, and at VSM level as well. And we've got some narrative in there. So with your own organization reports that you receive, hopefully in the next couple of months, this will be tailored towards your own data. And that shows you at non-clinical level, at clinical level, and then at the medical grades where the issues are in terms of progression for your BME staff. So we go to the next slide, please. So the representation of BME staff at clinical pay bands 8C to VSM. So this is a new area that we've added. So this shows you the gap in terms of what your representation is at the more senior levels compared to the overall workforce. So with this particular example, we can see that there's no BME representation at all at 8C to VSM level, and the gap has increased from the previous year. But again, similar to what I've gone through in indicator 1, we've broken it down to look at non-clinical and clinical level. So that shows you what your BME representation is at more senior level. Indicator 3, and I've not got much time, so I'll quickly run through that. So that shows the relative likelihood of BME staff entering the formal disciplinary process. So this shows you historically how the trust is performing compared to at a regional level and a national level. And we've got some narrative at the top as well, which I think is more helpful than the actual relative likelihood. So in this particular example, just under 2% of the BME workforce enter the formal disciplinary process compared to 0.7% of the white workforce. And then if we go into the next slide, please. So within the staff survey indicators, we've tried to disaggregate the data further. So indicator 5, the percentage of staff experiencing harassment, bullying, or abuse from patients. So the first chart shows you what's happening at organization level. Then you can benchmark it or compare yourself at a regional level and at a national level. But I think the disaggregation is where the most important part of the data comes from. So the first part shows you at a top level, and then we've further broken it down to look at the various different ethnic groups. On the right hand side, we've further broken it down to look at ethnicity and gender, and then lastly we've further broken it down to look at occupation and by ethnicity, so you can see where the issues lie within your own organization. I think that's at the end of my part, so I'll hand over to Khalida now.
Next slide, please. Hello, my name is Halida. The National EDI Repository has been developed to offer you a body of knowledge to support you to implement the 6 high-impact actions as set out in our National NHS EDI Improvement Plan. It consists of 3 distinct types of content under each of the high impact actions. So we have case studies, we have resources and toolkits, as well as research and evidence to support business cases. The case studies are very unique to the repository and should help you to develop a continuous improvement approach. We have recently done some follow-up interviews with the case studies that are already published on the repository, as well as receiving new case studies from the ambulance sector and primary care. Our team is very committed to working in partnership with providers, and we would like to support you to develop and shape case studies of good practice once you have also achieved completion of your high impact actions. Thank you. I'm going to hand you over to the chair.
Thank you very much, all 4 of you, for that presentation. What I'd like to do now is open it up for questions until about 12:05, if that's okay. So just a few minutes for plenary questions, because I think the real value that people will have here is in the breakout sessions, where we can get into some of that granular detail in a much smaller group. And I think that will be where we'll get most of the actionable insights for everyone for their own trusts. So can I ask, are there any questions that people want to raise by lifting their hand first? And I know there are a couple of questions that were raised in the chat, which I think have been answered. I think there was a question about how to get into the model hospital system, which I think has been picked up. And I think one of the questions, Riaz, into you was that mock-up that you showed basically the report that we'll be getting in the next couple of weeks by trust? If you want to kick that one off.
Yeah, no problem. So the mock-up version was just to share with everyone for this presentation. Your own organizational level report will be shared in the next couple of weeks, and that'll include the data that you submitted in the last data collection.
Fantastic, thank you very much. Are there any questions then? There is a question that's come in: how do you access the repository? Which I think, Khalida, was your section you just covered there.
Yes, there is a link in the presentation, but I will also put the link in the chat for you as well.
That would be great. Thank you very much. I don't think I see any hands up. One question I had was, clearly this will really help. Look, the NHS seems to love a league table to manage performance. So clearly this will help me as a trust chair understand where we're strong and where we're weak against those high impact actions and some of those individual levers that we're wanting to be improving. Will it help me understand who is a leader from a trust perspective in those metrics, so that I would be able to then go and reach out as a trust leader to another trust to say, what are you doing that's making you so good on that metric? I don't know who would be best placed to pick that one up. Hope the question makes sense. You know, the good thing about league tables is not just, for me, tells you where you are, but tells you who to speak to.
Yeah, it does. But can I just say, so the EDI improvement plan and the data on the dashboard, it's not about performance management. And for me, it's not about league tables. And you will have seen the EDI improvement plan is very much phrased around, are you looking at your own data and what are you doing? Because let's say a system, an ICB in Devon will have very different challenges. Let's say London, Tower Hamlets in the area. So it's very much around, are you looking at your own data and what are you doing about it? And how are you following up and how are you tracking it? So I think that was maybe part of your question. The second bit is, I think this NHS England has a role. So this is the work that Khalida is doing, and I'll hand over to her in a second to say a bit more. But we are keen to hear from you. If you think you're doing good work, let us know. We'll help you to raise awareness, because Mahmood, we are aware that when we talk to providers and systems, they say to us, okay, so I know the data, so what do I do? What have other people done? How can I pick it up quickly? And that's the work that Khalida is leading in the team. I don't know if you want to add anything, Khalida.
Yes, so we recently, I won't say the name of the trust as yet, but we have recently met with a trust who's done some fantastic work on High Impact Action 1, but the work done as part of High Impact Action 1 has had a positive impact on High Impact Action 3 and High Impact Action 6. So we met with them not last week, the week before. We're just writing up the content into a case study. So that will be published in the forthcoming weeks. We will ensure that Asmina receives a copy of that so that can be shared more widely with this group. But we're also looking at opportunities for that trust to present. So I'm sure there'll be an invitation for you all to attend that event very soon.
That sounds brilliant. Another question that's come in, I think, is how if you are a non-executive director on the board, is there any advice you can give in terms of how a non-exec director can support the wider board to drive EDI improvements, if we do in fact have any non-exec directors here in the audience? Any views on that?
So I will hand over to colleagues in terms of how people access the model health system. I'm hoping maybe Gugu or Riaz can help us out. But again, the EDI improvement plan talks about NHS boards and collective responsibility. So again, it's not just the executive, it's also the non-executives. And can I just say, this is what we hear when we talk to EDI leads. They say an organization makes a massive difference if our nets and our executive team focus on EDI. So it's both. Gugu, apologies for putting you on the spot, and if you don't know, that's completely okay. But I do believe if you have an NHS email address, you can just request access to the model health system, and you will be shown the data for your organization.
That is correct. So you can register on the website. You can use your if you already have an Opta access, which some people already have historically for other apps. You can use your Opta access, and if not, you can request. If you click on the register button, and then you can request access, and the model health system will help you with that.
Thank you very much. Charmaine, I think you've got your hand up if you'd like to ask your question.
Yeah, thank you, everybody. So I'm not a non-exec, but my lead non-exec, Mindy, is also on the call. So we work very closely together at Oxford Health. The question I had was, I was a little bit confused. We use model health data. We really interrogate staff survey data and our res data. So the report that Riaz, the mock-up report, Riaz, did you say that that's got new data and we're all going to get one at provider level that you're going to create? I just was a bit unsure whether all that data is already available elsewhere, or there's new indicators that are not available that only your report will give us.
Yeah, I think that's a good question. So with the organizational level reports, we've done it for a couple of years. So hopefully you should have seen the report previously, and that's tailored towards both the res and the WIDES indicators. So that gives you much more detail compared to the model health system or the model, it's called model employer system, whatever it's called. But you should have seen that. So the mocked up version is the mocked up version for now. Your own organizational level report will be sent out in the next couple of weeks. And I think there's Manal, and I'm sure Sandy's on the call as well. So I've gone through the reports with them already. So more than happy to do the same with you as well. In terms of the new areas, so we've added a few more areas in terms of more detailed information from the feedback that we've received from Trust. So that's kind of the new section part of it. But the report is exactly the same as it has been previously.
Thanks, Riaz. I don't think I have seen it, so I'm sure it's going somewhere in the team, but I'll connect with them to make sure that the non-exec and myself both get it. Thank you very much.
Thank you very much, everyone, for your questions. So what I'd like to do now is move us into the breakout discussion.